Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Clinical features of secondary syphilis are protean. The word protean means showing high variations or high diversity. This word came from a Greek mythological god's name Proteus, who can change his shape according to his will. Here, secondary syphilis is the great imitator of almost all diseases and can involve any organ. Some may develop flu-like prodrome. Prodrome means before. Before starting of the actual secondary rash, there will be some flu-like symptoms which consists of rhinorrhea, fever, headache, neck stiffness, arthralgia, joint pain, malaise, feeling of uneasiness, myalgia, muscle pain. Skin rash. Most common feature of secondary syphilis is skin rash along with generalized lymphadenopathy. Here, general features of a skin rash in secondary syphilis tends to be bilaterally symmetrical. Whatever the type of rash may be, general features will be bilaterally symmetrical, non-pruritic. Some may have pruritus, mostly in follicular type of rash. Discrete. Discrete means one lesion will be separate from other lesions, means not coalescing and will be separate. Sharply demarcated. Demarcation means we can clearly appreciate the surrounding normal skin from the lesion. Raw ham or copper colored. Raw ham means raw pork meat colored or copper colored, more prominent on upper extremities. Chest, upper extremities, which follows the lines of cleavage. Less prominent on abdomen and lower limbs. Has a special predilection for palms and soles. Whatever the type of lesions, if it is present on palms, it is called palmar syphilide. On soles, plantar syphilide. Coming to type of rash. Macular, maculopapular. Papular, papulosquamous. Pustular, pustulo-ulcerative. Nodular, follicular. Here, among all these types, papular is the most commonest of all the rashes of secondary syphilis and most characteristic also. We will see one by one. Coming to first type of rash, macular rash or roseolar syphilide, also known as roseola syphilitica. It is the first eruption to appear. Eruption means sudden development of rash. It is round to oval in shape of size 0.5 to 2 centimeters. Rose pink in color, distributed on trunk, palms, soles. Already told you it has a predilection for palms and soles. And upper trunk, flexor aspects of upper limbs. Macular rash spares the face. Macular rash is transient, which means it remains for only a few days. And then papular and papulosquamous eruptions evolve from macular lesions. Here I told you it is transient, which means it will go without getting noticed. Hence, patients who are having serological evidence of syphilis may not recollect the signs and symptoms of rash, because rash may be often subtle and goes unnoticed, because they may have just 1 or 2 lesions and will resolve on its own. We will see differential diagnosis of papular and papulosquamous lesions. As syphilis is a great imitator, it imitates here psoriasis, lichen planus, pityriasis rosea, pityriasis rubra pilaris and warts. For macular lesion, it imitates measles, rubella, drug rash, glandular fever, also known as infectious mononucleosis, HIV seroconversion, tinea versicolor, pityriasis rosea. For macular type of rash, these are all DDs. Papular syphilide. Already I told you, commonest and most characteristic rash of secondary syphilis is papular syphilide. It is dull red in color, indurated and have an indolent course, usually polymorphic, means various variants, which includes annular. Papules are arranged in a ring form with central clearing over face, axilla, palms, soles, and genitalia. For an annular lesion, the DD will be obviously tinea corporis. Next, Buschke-Ollendorff sign. It is pathognomic sign of secondary syphilis. It is nothing but a deep dermal tenderness elicited by applying pressure with blunt side of a pin over a papule. On pressing a pin by applying pressure with a blunt side of a pin, there will be deep dermal tenderness, which is nothing but Buschke-Ollendorff sign, pathognomic of secondary syphilis. Next, Corimbos or bombshell-like. Central plaque means central large papule surrounded by small satellite papules. It is rare. Corona veneris. The word corona means crown-like pattern. Wherever the corona word comes, it is crown-like. Corona virus. Corona psoriatica, seen in psoriasis. Here in corona veneris, papules along the hairline on forehead arranged in a crown-like pattern. Whereas in psoriasis, psoriatic plaque extends beyond the hairline onto the forehead in a crown-like pattern. There it is called corona psoriatica. Here it is a venereal disease, so it is called corona veneris. Next, collar of Venus or collar necklace of Venus. Leucoderma coli syphiliticum. Resolving rash may leave behind depigmented patches around the neck, means back and sides of the neck, resembling like a necklace or collar, called collar of Venus or necklace of Venus or leucoderma, depigmented patch, hence leucoderma coli syphiliticum. Obviously, for a depigmented patch, DD will be vitiligo. Next, condylomata lata. Pale, elevated, moist, sharply demarcated papule with broad base and flat surface, occurs in warm and moist areas and is highly infectious. What are warm and moist areas in our body? Under breast, axilla, groin, genitalia, perineum and perianal areas. In these areas, condylomata lata may develop. DD is condyloma acuminata. We will see difference between condylomata lata and condyloma acuminata. Here, lata is because of venereal disease syphilis caused by Treponema pallidum. There, it is caused by human papilloma virus. Here in lata, it is pale, whereas in acuminata, it is pinkish. Here moist, there in acuminata, it is dry. Here it is broad based. There it is narrow based, often pedunculated. We can pass a paper in between the lesion and the skin beneath it. In condylomata lata, as it is broad based, we cannot pass a paper between the lesion and the skin beneath it. Here it will have flat surface. There in acuminata, it will be thrown into folds. Both are infectious. Here in lata, if we do dark ground microscopy, the causative organism Treponema pallidum we can appreciate. So dark ground microscopy is positive in condylomata lata, whereas it is negative in condyloma acuminata. Split papules. Sometimes papules in the intertriginous areas may become elevated and fissured, called as split papule, found in angle of mouth, behind ears and nasolabial folds. Psoriasiform if papule is covered with scale, papulosquamous lesion. Lichenoid if papules are maculopapular rash having a violaceous hue, resembling or imitating lichen planus, here imitating psoriasis. Lenticular, pinhead to lentil or bean shaped papules on face and genitalia. We'll summarize what and all papular syphilides we have learnt. A for annular syphilide, B for Buschke-Ollendorff sign, C for Corimbos bombshell-like corona veneris, collar of Venus, condyloma acuminata. Split papule, psoriasiform, L for lichenoid and lenticular. All these are variants of papular syphilide. Coming to next, follicular syphilide. Here, if at all secondary syphilis rash is pleuritic, it will be mostly follicular around the hair. Here on the scalp, there will be two types of hair loss: irregular, non-scarring, patchy alopecia, called as moth-eaten alopecia, first type of hair loss. Not only scalp, it may also involve beard, eyebrows and legs, very rarely. Second type of hair loss over the scalp, telogen effluvium. For follicular rash, you have to remember two types of hair loss on the scalp. One is moth-eaten alopecia. Second one is telogen effluvium. Next, pustulo-ulcerative or rupial syphilide, seen in Louis maligna or malignant secondary syphilis. Syphilis in immunocompromised, mostly in HIV patients. Pustulo-ulcerative lesions will be explosive and widespread form, characterized by a prodrome. Already I told you, flu-like prodrome. Then followed by papulopustular eruption. Then followed by rapid transformation into sharply marginated ulcers, covered with characteristic hemorrhagic brown crusts organized in rupoid layers, hence the name rupial syphilide. These crusts are described as oyster shell or limpet-like crusts. Coming to DDs of rupial syphilide, ecthyma or keratoderma blennorrhagica. Next, pustular syphilide. It may imitate von Jumbusch type of pustular psoriasis. It is rare. Nodular syphilide is also rare. Actually, nodular lesions will be seen in late syphilis. Here in secondary syphilis, it is rare. Coming to DDs of nodular syphilide, deep mycosis, sarcoidosis, tuberculosis, cutaneous lymphoma and leprosy. Coming to nail features of secondary syphilis, pitting, paronychia, onychia, onycholysis, onychodystrophy and Bu's lines. Coming to oral mucosa, oral mucosal patches may get eroded superficially, forming snail track ulcers or serpiginous ulcers. There may also have development of papules and plaques in the oral mucosa or rarely in genital mucosa also. All these moist lesions are highly infectious. In oral cavity, these patches may be present on any part. Palate, soft palate, hard palate, oropharynx, larynx, may lead to hoarseness of voice, pharyngitis. Next, generalized lymphadenopathy. What is average size of a lymph node? 1 centimeter. Here lymphadenopathy means enlarged lymph node more than 1 centimeter is called lymphadenopathy. What is generalized? If two or more than two groups of non-contiguous lymph nodes, if enlarged, getting lymphadenopathy, it is called generalized lymphadenopathy. Everyone know how a lymph node will be in syphilis: rubbery, shorty, painless, non-tender and discrete. One lymph node will be separate from other lymph node, nothing but discrete. Bilaterally symmetrical enlargement. Most common lymph node affected is inguinal, 75%. Most specific is epitrochlear. Coming to systemic involvement, iritis, papilledema, optic neuritis because of optic neuritis, CNS involvement in the form of optic neuritis, headache because of basal meningitis which will be worse at night time, tinnitus, ear involvement, deafness, it is high tone deafness, parotitis, epididymitis, rarely, bone involvement in the form of periostitis, liver and spleen, hepatitis, splenomegaly, kidneys, glomerulonephritis, renal failure. We will revise in this diagram one by one from top to bottom. First, over the hair, two types of hair loss. What is that? Telogen effluvium and moth-eaten alopecia, irregular, non-scarring, patchy alopecia. Then headache also, which is worse at night because of basal meningitis. Here crown-like patterned papules we can appreciate is nothing but corona veneris. In eyes, iritis, uveitis, papilledema. Coming to ears, deafness, high tone deafness, tinnitus. Next, in nasolabial folds behind the ear and angles of the mouth, split papules. Inside the mouth, snail track ulcers, mucosal patches. On neck, cervical lymphadenopathy. In axilla, axillary lymphadenopathy. On occiput, occipital lymphadenopathy. Over the neck, collar of Venus or necklace of Venus. Then, if occurs on the palms, palm are syphilide, on soles, plantar syphilide. In genitalia, moist areas, there will be condylomata, lata. In primary syphilis, primary chancre, in 10% of patients, it will leave behind a thin depressed scar, leaving a diagnostic clue of syphilis. It may be left in 10% of patients. And there is, in 10 to 40% of patients, there will be no clear demarcation between primary and secondary syphilis. Actually, primary chancre and primary syphilis have to resolve and then secondary syphilis have to start. Here, there will be no clear demarcation and still primary chancre may be present in 10 to 40% of patients when they present to us with secondary rash. Coming to liver, hepatitis, jaundice, spleen, splenomegaly, kidneys, renal failure or glomerulonephritis, which is rapidly progressive glomerulonephritis. Femoral lymph nodes may also get affected. Bone is affected in the form of periostitis. Remember the channel name, The Average Derma Doc. Don't forget to subscribe and share. థ్యాంక్ యూ. హస్త la vista. До свидания.